One of the most common procedures we perform in the shoulder is called shoulder arthroscopy. Shoulder arthroscopy is when we make 3 or 4 small incisions, even less than a centimeter, and we use a camera and small instruments to perform procedures in your shoulder. You'd actually be quite amazed what we can do in the shoulder. We can remove things, we can reattach things, and allow you to get back to sports quicker than the old procedure where we made larger incisions. Shoulder arthroscopy is done as an outpatient, whether it be done in the hospital or the surgery center. The procedure takes about 45 minutes to do and will typically let you go home once you've recovered, sometimes an hour or 2 later. We like to start physical therapy almost right away. We'll start as early as 2 days after surgery, because the most important thing after shoulder arthroscopy is to get it moving and prevent a stiff shoulder. Now, depending on whether you've had a repair of tissue in your shoulder or removal of bone in your shoulder, like the famous bone spur of the shoulder, our goal is still to get it moving. Whether you move it yourself or the physical therapist help you move it depends on whether we had to repair something. If we've had to repair tissue, then often the therapist will move the arm for you, and you'll be in a sling for anywhere from 4 to 6 weeks. If we didn't need to repair anything in your shoulder, and we simply remove something, we'll let you move the arm right away, and that sling will be there for your comfort. After 6 weeks, we'll see you back in the office, remove the sling, or at that point, recheck your range of motion to make sure you can get back to activities you enjoy. If we didn't perform a repair, typically you get back to things like even starting to throw a ball, or play tennis, or bowling. If we repair tissue in your shoulder, typically at 6 weeks, it's time for you to start moving it. We'll remove the sling, and in physical therapy and at home, you'll be moving the arm yourself. By 3 months, we expect you to be about 85%, and that's most patients. Some patients are a little behind, and some patients are a little ahead. Over the next several months, we hope that you get back to full motion and start increasing your strength. At 6 months, if you're an overhead athlete like a pitcher, or maybe you want to serve a few tennis balls, that's the point when you'll begin doing those activities. Over the following year, the shoulder will get better and better. Our goal ultimately is to get you back in your game.